I've been thinking about this topic for years, and today I want to share something important with you. In 1982, an FDA panel concluded that thimerosal, a mercury-based preservative used in vaccines, was toxic, caused cell damage, and failed to effectively kill bacteria. They stated plainly, thimerosal is not generally recognized as safe or effective. Hello, I'm Dr. K. Paul Stoller. In this video, I want to share the letter I sent when I resigned from the American Academy of Pediatrics in 2008. After 2 decades as a fellow, I could no longer stay silent. Today, millions of children with autism and learning disabilities carry the burden of proof that neurotoxic metals like mercury are harmful to the human brain. But how did we get here? What happened to the precautionary principle? When did protecting a program become more important than protecting a child? As evidence mounted that thimerosal may be linked to one of the largest man-made public health disasters in history, institutions chose to protect their reputations and funding sources rather than speak the truth. This wasn't a case of ignorance. It was a willful cover-up, an alliance between government agencies and powerful corporations. Mercury in biologics is not a relic of the past. It is a clear and present danger to public health. While most developed nations banned thimerosal years ago, the United States did not. And so the autism epidemic continues here, unchecked. In June 2000, a secretive meeting was held in Simpsonwood, Georgia. Vaccine manufacturers and government officials gathered to discuss early CDC data that showed a troubling connection between mercury exposure and developmental delays. Dr. Dick Johnston, a key participant at that meeting, privately admitted, "Our first male in the next generation was born today, and I do not want that grandson to get a thimerosal-containing vaccine until we know better what is going on." He wanted protection for his family, but the public, we were kept in the dark. Economists at UC Davis projected that by 2025, the financial burden of autism in the U.S., including medical, educational, and productivity losses, could reach $1 trillion. That's more than the GDP of most countries. And if we do nothing, if we fail to identify effective interventions, those costs will only escalate. In 2008, I sent this letter to the AAP. The AAP has not only ignored mounting evidence, they've enabled a false narrative. Despite their 1999 promise to remove thimerosal, most flu vaccines still contain it. The so-called trace amounts, still hundreds of times more than what's considered hazardous waste by the EPA. 50,000 parts per billion, that's the level of mercury in multi-dose flu vaccines still given today. For perspective, 0.5 ppb can kill human brain cells in lab studies. The CDC still insists the autism rise is due to better diagnosing. But there are no hidden populations of elderly adults with autism. They don't exist. Autism isn't a genetic epidemic, it's an exposure epidemic. Mercury is in our water, our fillings, our air, and for decades it was injected directly into infants. No agency has ever tested thimerosal for developmental toxicity in children. And when those who should have spoken up didn't, others filled the silence with lies, pseudoscience, and PR spin. I can no longer in good conscience support the AAP. I will not pay another dollar in dues to an organization that refused to act while millions of children were harmed. Some will say this is controversial. I say it's overdue. Mercury has no place in medicine, especially not in something injected into children. This video is not just a resignation, it's a call to conscience. The truth is out there. The question is, what will we do with it? It's time to rethink everything, because almost everything we have been told was a lie. The end.